When does life stop? This was a question raised by New York Times contributor Joseph Goldstein this week when talking about doctors using a new technique for heart transplant harvesting, specifically pumping blood through the body to keep the organs alive while they do the harvesting. See, this issue has come up in particular for coma patients who are considered too far gone to ever recover and for whom the families have often withdrawn life support services. At that point, those patients are usually declared dead once their heart naturally stops, and then that heart is not useful for transplant due to damage caused by oxygen deprivation. Surgeons discovered, though, that by artificially pumping blood back through the organ, the heart recovers to a degree sufficient to make it usable for transplant afterward. And so by pumping blood through that organ, but not pumping blood through the brain, these surgeons have argued that they're essentially keeping just the heart on life support and allowing it to be more usable for future recipients. The big problem here, though, we don't have a good working definition of what even constitutes death. The one we currently use is the heart stops. So if I pump blood back through it, some surgeons are arguing, therefore I'm bringing the person back to life and now harvesting an organ from a living individual. And there are other working definitions like brain death, but that one too is not as clear-cut as it might sound. And even more importantly, in this situation, it is circulatory death and not brain death that's used to determine when to start using this particular procedure. And for that reason, there are a number of surgeons who are pushing back strongly against this, saying it basically violates the dead donor rule, and we don't know if the person might experience pain or suffering as their organ is taken, even if they are never going to come out of that coma. So as you can see, this is an incredibly complex and nuanced conversation, which brings us back to asking the question,